Hello, I'm Dr. Afonso Salgado, here to show those of you who bought this equipment what's inside and how to use it simply, right? This right here is the Miltapad. It features a touch screen and it has two spots where the emission occurs from the laser and the LED. This silver area right here, everyone, consists of two large magnets. These magnets are what create the electromagnetic field. Miltatherapy, both Miltapod and Miltapad, the pad is more modern, 5 to 8 times more powerful than the pod, uses an electromagnetic field. This is what creates a tunnel to allow for deeper penetration into the tissues. Well, let's talk a little bit about the programs. The Miltapad has 20 programs, and here it has several folders. The first folder you press, which says Basic, contains the analgesia program to reduce pain and the anti-inflammatory one. Swipe your hand this way and you have the healing and edema programs. So it's useful for those specific indications. Swipe once more and you have anti-infective and universal, okay? So when you pressed, for example, anti-infective here, you pressed it, it triggers both areas of the probes. But I can also press here and use only one. I can use it on a child or an elderly person, so a smaller surface area, okay? So these are the advantages we have with this type of equipment, okay? Then everyone, you have other folders, okay? So when I go back here, I have the rehabilitation folder. I click here. So the first basic folder has 6 programs. I click here on rehabilitation and I'll have 6 more programs. I have vascular here, which is it was created to cleanse the blood. Then it has liver, which is for detoxifying the liver. Then you'll have intestine. It's a specific program only found on the Miltapad. And then you'll use, for example, the minutes on the ascending colon, transverse colon, and descending colon. And then you also have stimulation for organs that are under functioning, okay? Swipe your hand here. Then there'll be a regeneration program, and you have a program specifically for Schumann waves. Schumann waves are those that provide balance in nature. So when you apply Schumann waves, you calm down, because Schumann waves have a frequency between 7.8 and 13 hertz. So you'll use them to bring balance to the person. So I always start by using Schumann on the brain for the person who arrives. I've got so many problems to solve, bills to pay. Who doesn't? Everyone does, right? Normal people, right? So that's when you use Schumann. So did you see? I've shown you the first 2 folders here. The basic one, 6 programs. Rehabilitation, 6 more programs. You swipe over here, there are 2 other folders. The endocrine folder, which is the hormonal part, where you have the first is the sympathetic stimulus is called orthosympathetic. Ortho, why? Because it's parallel to the spine. So when you press orthosympathetic, it'll only stimulate the sympathetic to give your accelerator a boost. The parasympathetic is for your recovery, your recuperation, your rest, your digestion. Someone who's wired, has trouble sleeping, has trouble going to the bathroom. So you, for example, will use the parasympathetic to slow things down. Is that clear? Someone who has, as I've seen many times with patients here in the United States, breathing problems, they have bronchospasms, right? They have trouble breathing. You'll use the sympathetic and place it on the first rib to bronchodilate. So this is how we teach within our mentorships. This video is just so you have an idea of what you have here to use, okay? Then you swipe over here, you'll have adrenal. So people who have an altered hypothalamic pituitary adrenal axis, right? So you'll select adrenal and place it where? Right over the adrenal glands, over your kidneys, right? And what do you have here? Thyroid. So if I have a thyroid problem, I come here, press it, hit enter, and I'll use it on my thyroid. It's going to balance the thyroid. How cool is that, right? So these are exclusive programs. So we've already shown folder number 1, basic 6. Folder number 2, which has the rehabilitation part, 6 more. The endocrine part has 4 more. And here you go to the last folder, which is the neurological part, which has 4 more. There's dopamine release, GABA, acetylcholine, and serotonin. So I complete 20 programs here. First folder 6, second folder 6, third folder 4, fourth folder 4. So 6 and 6 is 12, plus 8 is 20. So you have 20 programs here at your disposal that you should follow, following the guidance of your healthcare professional. If you are the user, if you are, the clinician, then I suggest that you follow along with our mentorships. There are many protocols, multiple protocols for using this tool, which I say is a Ferrari in our hands, okay?